Hi, my name is Nicole Bobko. I have been a nurse for the last 12 years. I'm a nurse at Stamford Hospital, and I also am the healthcare consultant at the preschool here at Boneem. In my 12 years of being a nurse, I have never experienced anything that I've experienced in these last 6 months during COVID. When COVID first struck, we didn't know what was happening. We kind of thought, oh, flu season, no problem. And then every day it would change. And it got to a point where I didn't know what I was walking into at work. I didn't know who I was going to see, where I was going to go. If anyone works in a hospital, they know that you never know what you're walking into. It's always different. But this was different. This was, you saw healthcare workers scared and not sure, but we still went to work and we still put on our bravest face and took care of our patients. I work in pediatrics at Stamford Hospital, and most people thought kids weren't getting it. They didn't experience what the adults were experiencing. And that's true to some extent. But we did have kids, and we had kids that had COVID. And we were their face of safety. We had to walk in there and let them know that they were in the right place and we were going to take care of them. The probably hardest part of this all was I also worked in the NICU during this time. And at the beginning, we didn't know if babies would get it from their mothers. So when babies were born to a mom with COVID, they were separated from them right away. And I worked maternity, and that doesn't happen. When you have a baby, you get that baby. But now, your healthy baby is being taken from you. And it was one of the hardest things to be part of. We saw mothers who didn't see their children for days. And it was us, the nurses, who were their link between them. Normally, you would never take a picture or a photograph or a video of someone else's baby, but we were doing that so a mom could see her baby. I'll never forget, a mom called me on the phone, and I said, if it's okay, I will use my phone, and I will take a video of your son for you and send it to you. And the sound of her voice was, oh my God, please. So I went in with my own phone, and I took a video of this little one-day-old baby who never met his mom yet, or his dad, or any of his siblings, because we had to separate them. And it was just an experience that you never forget. It's changed since then. We've learned a lot, and we now know we can keep babies with their mom, and I'm so glad we're there. But if you've never seen or heard the pain in a mother's voice that she can't see her newborn, it's just something you'll never forget. So that's something I'll never forget, and it's just something I hope no one ever has to go through again. In terms of the community, we became such a team. You're always a team in a hospital, but this was beyond. Everyone stepped up and was like, what can I do more? Most people don't want to come in for overtime, and everyone's like, I'm coming in, I want to help. I want to help my team, I want to help my nurses, I want to help my doctors. And it's just that sense of community and teamwork that I don't think we'll ever forget. And even the community, every day I went to work during the height of the pandemic, I had a meal, a warm meal that was delivered from the community. People just wanted to help do what they can do, and it's something that we will never forget. And yes, it seems as it's gone back to normal and a sense of normalcy in the hospital, but we still see COVID and we don't forget. So I guess I just want people to know that community is everything, and your teammates and your workers are the world. Thank you.